Arcuate eminence of the petrous temporal bone is caused by superior semicircular canal. Root value of phrenic nerve is C3, C4, C5. Middle thyroid vein drains into internal jugular vein. Ophthalmic artery is the branch of intracerebral part. Structures passing through the foramen ovale is emissary vein and mandibular nerve. Which of the following regarding mandibular nerve is correct? That it passes through foramen ovale. The action of superior oblique muscle is abduction, intorsion, and depression. Where is ciliary ganglion located in the orbit? Apex of orbit between optic nerve and lateral rectus. The facial nerve transverses through parotid gland. Structure passing through the foramen magnum are vertebral artery and 11th cranial nerve. The esophagus commences at the following level, lower end of cricoid. Regarding palatine tonsil, which of the following is an incorrect statement? It has sensory innervation from vagus is incorrect. It lies on the superior constrictor. Lymph from it drains into the deep cervical nodes. It is a derivative of the second pharyngeal pouch. Posterior boundary of carotid triangle is sternocleidomastoid. The only pharyngeal muscle innervated by the glossopharyngeal nerve is the stylopharyngeus. Incisor foramen in the mouth is foramen of Scarpa. The retina is an outgrowth of the diencephalon. Retraction of the protruded mandible is done by masseter and temporalis. Excessive hemorrhage in tonsillectomy result from injury to venous concomitants of facial artery and palatine vein. Which structure passes through infraorbital fissure? Zygomatic nerve. Which vertebrae has the most prominent spine? C7. Artery palpable at the anterior border of masseter is facial artery. Which is true regarding parotid gland? Stenson's duct opens opposite upper second molar. What is true of tonsil? It is drained by jugulo-digastric lymph node. Parasympathetic division innervates detrusor muscle. What is true about pharyngotympanic tube? Supplied by glossopharyngeal nerve. What is true about opening of jaw? Lateral pterygoid muscle contracts. Nerve supply of the mucosa of larynx is internal laryngeal. Posterior chamber of the eye refer to the space posterior to iris. Sphenopalatine ganglion does not supply sublingual gland and ciliary ganglion. So sphenopalatine ganglion supplies nasal mucosa and palate. Taste sensation from the anterior two-thirds of tongue is carried by chorda tympani. The tip of the nose is supplied by ophthalmic nerve. Circulus iridis major is situated in root of iris. General sensation to the posterior one-third of the tongue is mediated by the glossopharyngeal nerve. The following are the contents of interpeduncular fossa except trochlear nerve. So what are the contents of interpeduncular fossa? Mammillary bodies, oculomotor nerve and tuber cinerarium. Toynbee's muscle is tensor tympani. Skull consists of 22 bones. Which is not a content of tympanic cavity? Posterior auricular nerve. Which is not supplied by hypoglossal nerve? Stylopharyngeus. 7th, 9th and 10th cranial nerve ends in nucleus tractus solitarius. Cuff receptors are not seen in soft palate. Inferior and lateral movement is produced by which extraocular muscle? Superior oblique. The smallest cranial nerve is the olfactory. Lamina cribrosa is a modification of sclera. Choroid fissure of the eye permits the entry of hyaloid artery. Which of the following statement regarding middle constrictor muscle is wrong? It is a derivative of the second pharyngeal arch is wrong. What is true is it lies on the superior constrictor. Lymph from it drains into deep cervical lymph node and it has sensory innervation from vagus. Anterior spinal artery is a branch of vertebral artery. The vein of Galen drains into straight sinus. The nerve supplying submandibular gland is prevertebral fascia is posterior to all except scalenus anterior. So the prevertebral fascia is posterior to carotid, esophagus. Root of teeth contain all of the following except enamel. Root of the teeth does not contain enamel, it contains cementum, dentine, and pulp chamber. Adult larynx extend from cervical spine C3 to C6. True about fourth ventricle is rhomboid fossa forms the floor. Structure passing through foramen spinosum is middle meningeal artery. Parasympathetic supply to parotid gland is from otic ganglion. Which among the following does not pass through superior orbital fissure? Optic optic nerve. So what passes through superior orbital fissure? Oculomotor nerve, ophthalmic division of trigeminal nerve, and trochlear nerve. All the muscles of the face are supplied by facial nerve except levator palpebrae superioris. So levator anguli oris, corrugator supercilii, and risorius are supplied by facial nerve, but levator palpebrae superioris is not supplied by facial nerve. Tip of tongue drains into submental lymph node. Craniofacial angle is 130 degree. Which of the following structures is inferior to sphenopetrosals in chondrosis? Cartilaginous part of auditory tube. All are true about vocal ligament except that it is discontinuous with cricothyroid membrane. It is continuous with cricothyroid membrane. And what other is true about vocal ligament? It is medial to vocalis, it is lined by stratified squamous, and it is fibroelastic tissue. Parathyroid gland are supplied by which artery? Superior thyroid and inferior thyroid. All of the following structures are in lateral wall of cavernous sinus except trigeminal. So which structures are there in lateral wall of cavernous sinus? Oculomotor, trochlear, and ophthalmic. All of the following structure are related to cavernous sinus except optic nerve. So fourth nerve, sixth nerve, and mandibular division of trigeminal nerve are related to cavernous sinus. Trigeminal nerve does not supply buccinator; it supplies masseter, anterior belly of digastric, and which nerve passes through Meckel's cave? Trigeminal nerve. Alderman's nerve is a branch of auricular branch of vagus nerve. Cranial accessory nerve supplies soft palate. Palsy of right genioglossus causes deviation of tongue to right, which is not a feature of oculomotor nerve palsy. Meiosis is not a feature of oculomotor nerve palsy. What are the features? Difficulty in accommodation, superior gaze palsy, and diplopia. Waldeyer's lymphatic chain is formed by all except postauricular nodes. So it is formed by palatine tonsil, pharyngeal tonsil, and tubal tonsil. Which one of the following is a branch of facial nerve? Greater superficial petrosal nerve is a branch of facial nerve. Depressor of mandible is lateral pterygoid. Nerve of pterygoid canal is sympathetic plus greater superficial petrosal nerve. Tympanic plexus is formed by tympanic branch of glossopharyngeal nerve, which is the direct content of cavernous sinus, abducent nerve. Superior malleolar ligament connects head of malleus to roof of epitympanum. Tympanic plexus is present in medial projection of middle ear cavity and petrous part of temporal bone. The secretomotor fiber to the parotid gland passes through otic ganglion. Safety muscle of the tongue is genioglossus. Superior cerebral vein drain into superior sagittal sinus. Facial nerve supply all except parotid gland. So facial nerve supplies lacrimal gland, nasal gland, and submandibular gland, but it does not supply parotid gland. Subcutaneous muscle extending from the clavicle to the mandible is platysma. Casagnac tubercle is carotid tubercle on sixth vertebrae. Muscles of tongue are supplied by hypoglossal nerve. Cranial part accessory nerve supplies all palatal muscles except tensor veli palati. So the cranial part of accessory nerve supplies palatoglossus, palatopharyngeus, levator palati, but not tensor veli palati. Branches of subclavian artery are all except subscapular artery. So the branches of subclavian artery are vertebral artery, thyrocervical trunk, and internal thoracic artery. Nasolacrimal duct is directed downward, laterally, and backward. Transverse ligament of atlas is a part of cruciate ligament. Which nerve is in close relation with root of the lower third molar? Lingual nerve. Middle cranial fossa is supplied by maxillary nerve and mandibular nerve. A person has inability to look downward and laterally. The nerve injured is trochlear. Skin over the angle of mandible and parotid area is supplied by a greater auricular nerve. Pseudo-unipolar neurons are seen in spinal dorsal root ganglion. Which of the cranial nerve decussate within the brain? Trochlear. Sensory. Which of the cranial nerve decussate within the brain is trochlear? Sensory nerve supply of pinna is mandibular nerve and facial nerve. Posterior fontanelle are ossified at the age of 6th months. Trigeminal nerve has how many nuclei in CNS? 4. Portal circulation is seen in which of the following endocrine gland? Hypophysis cerebri. Lacrimal gland is supplied by which of the following ganglia? Sphenopalatine ganglion. The following ligaments are present in temporomandibular joint except alar joint. So the ligament of temporomandibular joint are lateral temporomandibular ligament, sphenomandibular ligament and stylomandibular ligament.